Hello, everybody. Happy Friday and good afternoon. Thank you for everyone that turned in from around the world. I'm so excited to be here. I woke up this morning and I was putting my makeup on and I thought, I have purpose. So excited to be here. Let's get started. You say no sound. Good. Welcome to our my first Mint webinar. We're going to be talking about barb and smooth thread today. Okay. We're going to talk a little bit today about barb and smooth thread today. I first got exposed. I'm just so excited to be here, so excited to talk about my passion, which is threads. The first time I saw threads was at the Las Vegas Aesthetic Show in 2014, and I fell in love immediately. I remember watching, it was Dr. Creamy that was on, and I remember watching and thinking, this is where aesthetics is going. I have to do this. I had been practicing for over 10 years at that point, and I knew that I had to bring this into my practice. So straight away, I started training in 2015. I went on my journey, and I've taken over 20 plus trainings. At that time, today, I have two offices, one in Newport Beach, California, and one in Rodeo Drive. The founder of Live Gorgeous OC. And when I'm not working 8 days a week, I train because this is my passion. So I have attended over 20 trainings and I just love it. And so my passion is to bring to you guys and answer all your questions and make sure that we really get down to the nitty gritty. So whatever you have, questions that you have, I'm no holds bar. I'm going to answer all of them today. One of the things I really appreciate about threads is that it's really a nice adjunct to what you're already doing in your practice. So if you are very adept at doing fillers and lasers and neurotoxin, you really this is sort of the next generation of injectable. It can do some things that there's some limitations with fillers. I love fillers, great for volumizing, great for filling in gaps, but threads you really want to use when you really want to tighten the skin, reapproximate tissues, where there's some limitations with fillers. So we'll discuss that as well. And you can really design the face. I'm going to spend a lot of time talking about designing the face and really sculpting the face. I have patients that are very, very young, in their 20s and more mature, even up to their 80s, and I can augment all of them. And in your 20s, you don't necessarily have a lot of loose and dragging skin, but you do want to reshape the face. And I've had models come in and just, want to just change and augment their look a little bit to make it a little bit fresher, sharper. So, and for more mature patients, when you have a little bit more of that dragging skin, you really want to be able to reapproximate those tissues. A little bit of a lag time. Good. So the history of PDO threads. So the difference between, sorry guys. The history of PDO threads. So as you know, that there used to be threads that were non-dissolvable. And so they had a whole lot of issues with that. And so today we're going to talk about dissolvable threads. They took it off the market just because anytime you have a thread or an implant in the face, that the face is highly mobile. So anytime you have an implant in the face, which is what those other threads were, they tend to migrate and have puckering issues. Today we're going to talk about dissolvable threads, which don't carry as many issues if you do it right. We're going to talk a little bit about the difference between cut threads and molded threads. Mint threads are molded threads. what's currently, many of the other threads are cut threads. And the issue with cut threads is that at the point of cutting, you don't have as much tensile strength, so those tend to break a little bit more easy. If you have a molded thread, you're going to have a lot more strength, and you don't have to worry so much about fixing problems and things like that. It usually lasts up anywhere from 6 to 8 months. So via hydrolysis, that's how it breaks down water. The dye that you see there, the blue dye, that goes away within about 2 months. We'll discuss a little bit about the facial anatomy, and I'll make it pretty simple. Up in the frontal area, let's pull that back. In the temporalis area, most of the vessels that you want to avoid fall into that superficial, fascia. There's a superficial temporal artery that runs along there. So the areas that you want to avoid is deep within here and also in the semast area. So we'll talk a little bit about pinch anatomy, and I'll demonstrate that when we go to our model. So pinch anatomy will help you avoid some of those deeper vessels when you're using your cannula. Sorry, guys, there's a little bit of a delay. We'll talk about how to avoid some of those deeper structures of the facial artery. Right here, we have the neck. So today on our model, we're going to work on jowls and we're going to work on the neck. The platysma is 2 sheets of muscles. As we get older, they start to separate. So we're going to work on some of those tissues to tighten up and pull the skin, and also work on the skin itself. Mechanisms of thread lifting. So we're going to, again, we'll use that pinch anatomy, and then we'll reapproximate those tissues using that. These are some of the vectors that you can employ. I'll spend most of my time talking about the vectors. That's really most of your assessment. If you can take your time using and judging where you want to, how you want to make those vectors and how you want to reapproximate that skin, that's really half the battle. So we'll really dive into that. We'll make sure that we mark out everything and have everything proportioned how we want it to be. Anywhere you have skin, you can use barb and smooth threads. I'll talk about the difference between barb threads and smooth threads, where you would want to use them, why you would want to use them, what gauge. I'll talk about all the different colors. I got a lot of questions about that as well. This is an example of one of my mega sessions. I know I have a lot of questions. There's a few things that those threads do that I really would like to get into. What depth, what area you'd like to place those threads, and why it would be beneficial for you. We'll talk about fat pads. We'll talk about skin. We'll talk about crepey skin. Here in the US, when you're doing your evaluation, you want to make sure that with the mint threads, we're talking about bidirectional barbs. So in the top portion, it's arranged one way, and the bottom portion. So there's a fixed portion, and then there's a pull portion. That's going to be important because the barb threads allow you to give a direction to your threads, whereas the smooth threads, they don't have a direction, but you're still going to get some tightening. So we'll talk a little bit about fixed points, why you need a direction, and where you want to pull that direction to. There's different types of threads we'll talk about. There's screw threads, there's mono threads, there's barb. Today we're going to use the mint fine, and so we'll fully dive into that, and you can ask all the questions there. Just as a little side note, the smooth threads are used when you, we can use those in the fat pads and also under eyes and different areas, anywhere you have skin. Specifically for the screw threads, you want to use those in areas where you want volumization, because those threads act like 0.05 of a filler, so you can use them also as a filler. This slide is just showing that there's a little bit more longevity when it comes to the PDO threads. Consultation. So that's kind of what I'm known for, and that's what I really want to discuss, is really taking your time in the consultation, because that's where you're going to get the best results if you take your time in this area. Really look at the patient, look at the asymmetries, make sure that you're any person that you wouldn't do a filler on, you also would not do threads on as well. Make sure you're consenting your patients and all of that and discussing fully the procedure. Patients to avoid. This is the big one. And I think that if you choose your candidates right, you'll not run into a lot of trouble. You don't want a patient that is too asymmetrical. You don't want a patient that's too thin. You don't want a patient that's their tissues are too heavy, because you're not going to have a nice outcome. We'll talk about, again, marking, fixing points. I like to draw, and when we go to Natasha, our model, we'll talk about areas that you want to pick up and areas where you want to fix, and we'll mold those two together. And then we'll mark the patient out. Post-operative. We'll talk a little bit about post-operative care and things that you want to do. I usually just hand patients a handout so that they know everything that what to expect, when to shower, when they can go for a sauna, when they can exercise. All of that can be discussed. And then I think that's it. We're going to go to questions, and we'll go to our model. Well, let's talk a little bit about complications. Hopefully you won't have any complications if you use that pinch anatomy that we're going to go over today. But if you do have problems, especially with puckering, you want to make sure that you fix that right away when they're on your table. Infection is very rare if you're using this is a clean technique. This is not a sterile technique. So you want to make sure that you use, you're cleaning everything. You're making sure that their hair is washed before you come in. You put their hair back. All the things that you would do for filler, maybe a little bit more. You want to make sure that the face is as immobile as possible. I know in Asia, they want you to wear like a head wrap. I don't think that'll be very, people won't really go for that here. However, you do want to make sure that they're not opening their mouth really wide when they're after their procedure, and keeping pretty still. And these are some of my patients. See if I can pull that. Oh, when do you want to do smooth or PRP? Go back to previous. I'll read some of you guys. Hello from Vietnam. When do you want to do smooth threads? I usually do barb threads and smooth threads at the same session, but you can do them separately. As far as PRP, Sculptra, any of those things, I prefer you do your injectables before, but you can do it after or during, as long as you don't do it in the same place as you place your barb threads. As far as laser treatments, any kind of heat treatments, I really prefer you either do it before or you wait at least 8 weeks afterwards. And a lot of times you find that you won't need your heat modality after you've done your threads, especially if you marry the barb and the thread together. You're going to have a lot of just some really beautiful outcomes. These are some of my patients. You can see that I've done usually a mega session of both barbs and smooth threads. So it's really beautiful. That's what we're going to treat today. We're going to do the neck, and you can see just the texture and the quality of the skin so much better. She is post 8 weeks. This is a patient that I did jowls and smooth threads. Do you like hyperdilute radius as an alternative to Sculptra? Yes, I like radius as well. But a lot of times, remember now, when we're talking about barb and smooth threads, you're actually talking about reapproximating that tissue. That's something that you can't do with fillers alone. You can't reapproximate the tissue. Do you like, okay. Can you talk more about the thread ends? We'll get into that, what you do with the end of the threads when we go to our model. Thank you. Did you use Sculptra in that same area? No, I didn't. This is all smooth and barbed threads. This is another patient. That's actually the patient that you'll see today. I don't do a traditional cat eye because I don't think it's very attractive, but I will say this, that if you're going to treat brows, make sure that you're treating the brow and the lids separately, because the brow, you need elevation with barbed threads, but you need smooth threads in order to deal with the laxity in the upper lid. And that's another patient that we've done jowls on. I'll take a cool result. Hello from Peru. Hello. Do you use PDO in the nose? Yes. And I've been told that they're going to come out with nose threads soon. Okay, we'll go straight to I'll take a couple more of these questions. Is anyone else screen jumping? No. What is your post-procedure care? I usually give a list. I can send that out to you guys as well, but I just make sure that they don't wash their hair for 48 hours. No doggy or cat licking their face. That's the most important thing, is to sleep elevated, because you don't want them to wake up with so much swelling. I actually send them to a cryo place afterwards, where they do cryotherapy, and that really helps with some of the swelling. So I send them straight away. So if you have a place near you that does cryotherapy and have a relationship with them, that's wonderful. Hello from Peru. Hello. Let's see. Let's scroll down, see some other questions. What's the average number of threads that you would use in the neck, especially submental area? That's a great question. So usually for today, I custom everything. It's really, I look at the face and then I evaluate what I think is best. But I think a 4x4x4 is a good rule, meaning if you're going to start with your cheek, maybe use 4 barbed threads. If you're going to start with your jowls, use 4 barbs, and then the neck as well. You're going to use it depends on what the issues of the neck are. Usually the neck has just a lot of crepey skin, so it's not just reapproximating tissue, it's actually doing one of those mega sessions so you can really get that skin taut and pretty, because when you're using barbed threads, you're actually pulling, you're reapproximating that tissue. When you're using smooth threads, you're actually causing an inward contraction. So, and you can get some fat destruction. So it depends if you have a submental that has a lot of heaviness or you just a lot of loose skin. So those are different issues that you could deal with. How many threads do you use? Big facial lift. I think I answered that. How long do the results of the repositioning and fat tissue last? It depends on how much you do. So the more threads that you use, I think that the more longevity. I would say an average anywhere from 1 to 2 years. And also there's so many different factors, how mature is your patient? What is the quality of the skin that they walked in with? What is their level of activity? Are they big, do they work out like me? I do hot yoga, so I tend to run through my product a little bit quicker. So it just sort of depends on, what your lifestyle is. Hello from Brazil. Hello. Do you use smooth in the upper lids? Yes, I use smooth, I'll use twist, I use barb. So generally if I'm trying to lift a brow, because it's kind of that whole area, right? So you really want to, if they have, they need some temple work, you might want to volumize them first and then move up the brows with some barb threads and then use some smooth threads, or even you can use twist if they're really crepey and they're really saggy, use some twist in that area and that helps quite a bit. What is your favorite mint? It depends. It depends on how thick their skin is, but you can use the mint fine for those as well. Which threads do you use for the nose? Well, that hasn't come out yet. I think we're good. Any questions you have, I'll answer all of them. Can you show your work? I'm just about to do that. In which case do you use the double threads? The double needle threads? We're not going to do that today. We're going to use the mint fines. I think that's a different discussion. Which brow lift? Okay, so I think we're ready to go to our beautiful model. Hello. Put some gloves on. Hello. So beautiful. Okay, we have the beautiful Natasha. Natasha works for me. She's my esthetician. She does all my hydrofacials, and she's super gorgeous. We've already done a little bit of work on her. We've done her cheeks already, so you can see. So if you draw a line from the lateral canthus down, this is the mobile part of our face, and this is the fixed part of our face. That's one of the reasons why I liked the design of these threads, because you have the fixed portion of the thread, and then you have the pulling portion of the thread, which is exactly what you want. So here in this area where it's highly moving, and here in this area where it's fixed. So that's why you want to anchor these threads out here, because you don't move this part of your face very much, but you do here. Okay. So when I look at her, she's beautiful. We've done some work on her brows already. We've done some neurotoxin. We've done a little bit of filler. And like I said, she's had threads on her cheeks. So you can see that her cheeks are really in a beautiful position. There's just a little bit of laxity. When you look, you see how there's this look. Go ahead and smile for me, honey. Relax it. You see how there's this accordion thing going on. So we want to adjust for that. She has a little bit, put your chin down just a little bit. She has a little bit of that loose skin that we all kind of get, especially when you're a little bit on the thinner side. You tend to have just this skin that hangs down. She doesn't have too much submental fat when I pull, but she has a little bit on the side. So really, in an ideal world, you really want to use both barbs and smooth, because you want to reapproximate the tissue, but you also want to catch some of this hanging bit, and you'd be really hard pressed just to kind of pull up everything. You really need to address the skin itself. Even if you're having a facelift, you're going to get more longevity out of your barb threads if you use smooth threads, because if you don't, you'll get a nice pull, but the skin will sag on top of that pull, and it just won't be as effective. So drawing your effectors is really important. So today, because we've already done her cheeks, we're going to pull up that jowl. I'm going to start here in the back. We've already numbed her, thankfully. So there's a couple of ways that you can get the jowl. You can get the jowl by just putting the threads laterally. You want to be careful with that, because if you put too many threads laterally, sometimes you can widen the patient's face, and you don't want that. I like to drop a vertical all the way down. I've already done that, so she already has a really nice jawline. So we're just going to pick up a little bit of that laxity. We're going to do some barb threads, and then we're going to do some smooth threads. Do we have any questions? What technique do you perform to lift the outer corners of the eyes? Well, let's talk about jowls first. Breast lift, body. I have breast lift. I've done that. If you look on my Instagram, I have that. 4 threads per side, or Mark says 4 threads per side or 2 threads per side. Depends. So today I'm going to use 4 threads per side. So because I'm going to follow my rule that I just said, 4 times 4, and we'll pull that up. So I usually like to use 2 per port. So I'm going to use 2 mint fines here and 2 mint fines here. I'm also going to do underneath as well. Are there threads indicated for patients? No, never do any kind of treatments with patients with autoimmune disease. What augmentations of lips? You can do smooth threads. You can even do, what's really beautiful on lips is doing the twist threads. Those are really beautiful. Hi, Francesca. I love your work. I'm a nurse in Chile. Hi. Thank you so much. Thank you. Hello. How many times can we process the same region, and how long should it take? Meaning how many times you can do the threads in there. You can do it as often as you like. It depends on, you shouldn't have to do it that often, because once you pick up, really once you marry the barb threads and the smooth threads, you really won't have to retreat them very often. It might be more like every 6 months, maybe, if that. I've had patients that I don't see for a year, and they still look incredible. Now, that doesn't mean that they're still not doing their neurotoxin, they're still not doing fillers and things like that in between. Hi from Phoenix. Where are the threads manufactured? I think in Korea. Which size do you use for brow lift? Again, I think I still use the mint fine. Hello. Hi, Michelle. Francine rocks. Thank you. You rock. I see your mega sessions of smooth in the neck. What's the minimum number you would recommend, and what pattern as a mega session becomes hard for patients in terms of affordability? Great question. I think that that's a discussion that you have to have with patients right in the beginning. So, I always talk about budget and, what we want to achieve, and then we kind of go from there. So it just depends. Today, just to make things a bit easier for you guys, the pack of threads comes in 10. So I just say use your palm, and so 5 for each section. So this is about a palm size. So maybe we'll use 5 here, maybe we'll use 5 here, 5 here, 5 here. I think that's a good place to start. You can always have the patient come back. They don't have to do everything all at once. I just, in my practice, this is kind of what I'm known for. So people have an idea of what they're in for. So we discuss that fully. And, I have patients that fly from out of the state, out of the country. So they just want it one and done. So it just depends on what your clientele is like. Can you smooth out the puckering before you, absolutely, tying the knot? Yes, absolutely. Which size? Can we? Okay, yes, I love the combination of smooth and twist on the brow. Yes, I do too. It's great. Can we please talk and show your cat eye? Not today. Ask them to do another one, and I'll do another one. Which product from Mint line do you use? The Mint, the fines, and then I use all the smooths, all the twists, all of them. Have you seen people get pimples over the area? That's usually a cleaning issue. So I think, just make sure that the thread is not poking out. But usually if there's pimples, that area might have needed to be cleaned a little bit more. Can smooth threads alone get rid of submental fat? Well, it depends on how much submental fat, right? So a lot of times I have patients that are really full under here, so I'll cool sculpt them first. But if it's just like a little pocket, I say it's permanent. So depending on how deep you go, so the deeper you use that smooth thread and you put it in the fat layer, you're going to get some destruction of fat. You'll also get some fibrosis. The other beautiful thing about smooth threads is you'll also add blood flow up to that area. So it does 3 things. It gets rid of fat, it helps build up collagen, type 1 collagen, and it also will increase the capillary flow to that area. So that's why one of the reasons when you exercise, your skin looks so nice is because you're bringing blood flow up to that skin. Have you seen patients who break out over the threads? No, I haven't seen that. Are you able to treat the lids without doing a brow lift if the patient already has a high brow? Yes, absolutely. Do you have teaching courses? Yes, I do. You can look on my Instagram. What is the average thread use in the nose? Well, come on, guys. I'll do that separately. Do you use PLLA threads? I have. My preference is, this is just my personal preference. My preference is PDO just because I think that the PLLA, if you look at most of the PLLA threads, they're cones, right? So they don't have as much structure throughout. So most of the pulling is through the cones. I like that the PDO threads are molded throughout, so you have that strength throughout the whole thread. What did you use to numb? I used 1% Lido with a little bit of bicarb and then Epi to start her port there. Let's get started before she's not numb anymore and she won't like me. No. There we go. Yay. Can you share your PowerPoint? I don't know, Daniel, can we? Are you infiltrating with Lido? I didn't use BLT. I guess I wasn't so nice to her today. We didn't use BLT today, but we did numb. Okay. Ask your questions. Numbing. I think I answered that. I just usually numb the track. I've already pre-numbed her. So butt lift. Yes, you can do a butt lift. I think Sculptra sometimes is in combination with Sculptra. I think that's usually a little better. Any danger in the facial artery? Yes. So that's why I'm going to show that that pinch technique. in the temporalis, usually not usually, the superficial temporal artery lies within that superficial temporal fascia. So if you pinch it, not a hard pinch, but if you pinch it just a little bit and get your cannula in there, you'll avoid you're just picking up the dermis and the subq, you'll avoid a lot of danger areas. Here is the symass. Most of the facial arteries lie within that symass. So if you pick it up, you'll avoid that symass area. What vectors did you use on her cheek before? Well, that's a good question. I can show that when we sit her up a little bit. What threads did you use? Did you already place, and how many? I did 4 on her cheeks up high. I was up in her hairline and I went down, and I also did a couple down, straight down, because if you do this vector here, you'll be able to pick up her lateral neck. Did you mark the vertical lines? It would be better if you answered the question at the end. Oh, okay. I aim to please. Okay, so we'll get started. So I'm using an 18 gauge needle. I've already pre-numbed her. I just want to make sure that she's not closed by now. So we're using the mint fine. So this portion of the, I don't know if you guys can see, this portion of the thread is the anchor portion, or the fixed point portion, because the threads sit up differently. And here is the pull portion. So they're oriented, the cogs are oriented differently on each side. I like bevel down. She's already been cleaned and everything. You doing okay? Mm-hmm. Such a good girl. Ask her no. Oh, can I see? I was reading the questions. Go over the anesthesia. Maybe we'll do that at the end. Do I charge per thread? No, I generally don't. I charge per area. You doing okay? Mm-hmm. Good. So one of the nice things especially if you're just starting, take your thumb and put it at the end and make sure that you depress the thread at the end, because that'll allow you to pull out again. I wish someone had told me that, like when I was first beginning. That would have saved me so much drama, but it's nice because you can backtrack a little bit if you employ your thumb. You see how I'm employing my left hand and I'm pushing the skin onto the thread? That feels a lot more comfortable. When you're beginning, it's nice to pinch so that you know that you're in the right plane. I've just been doing it so long that I don't have to. You're doing so good. So I like to take and mold. And you want to make sure that you leave enough thread here. I don't know how close you guys can get, but that you guys can see that this is the fixed portion of the thread. You want to make sure that you have enough out so that I'm not going to tie today, but we can use a twisting. I like to use a little bit of ultrasound gel and sort of glide. And just make sure that all the cogs are engaged. Would you be able to go over the complications and troubleshooting for puckering? Yes, just have them sit up and unzip it. You can take your thumb and you can just kind of unzip everything. And when she sits up, if she has any issues, we'll do that. Hi from Kazakhstan. Hello. Will we have record after, like a treatment record? Yeah, I'm sure that your rep could make that available to you. Can we proceed with the demo and save questions for last? No. Because you're pulling up the skin, how do you treat the excess skin? That's a great question, and I didn't go over that. You want to make sure that when you're picking your candidates, that they're not so saggy to where, you know, they're really surgical candidates. You just want to make sure that you pull a little bit, you know, you're pulling up the skin and you're seeing, okay, it just has a little bit of drag, you know, maybe like less than an inch. Those are okay. Anything more, they really should have surgery. Hi, thank you so much. Hi, Stacy. Thank you so much for doing this. You're great. There Wait, don't scroll down, go up. There any risk of scar tissue developing around these threads? No, it's type 1 collagen. The fibrotic tissue that's being made only makes this, it's like good dense collagen. It's only making your skin better. You know, when we're young, we don't make any, we start to lose collagen after 25. So you want to add collagen. That's what makes your skin supple and tight and beautiful. So I'm going to do 2 per port. You doing okay? So good. Such a good girl. We're almost done. And you see, I like to cut at the end. And I sit them up before I cut, just to make sure everything is where I want it to be. I've put smooth threads in the glabella. I've not seen pimples over the area, so maybe perhaps try cleaning with some Hibiclens. I've used 2 threads so far. Turn. Oh gosh, that's looking really beautiful. Turn. Again, I'm just using an 18 gauge needle, starting my port. You doing okay? Mm-hmm. Okay, good. So here under her neck, I'm going to use 2 different vectors. One that rides right along the mandible, and the other one just right under. I want to make a little hammock for her underneath her neck. Then I'm going to go back and use the smooth threads. We'll use some longer smooth threads and some shorter ones. What threads did you already place? I placed 2 barbed threads here, and I'm on my 4th over here. I'm going to go slightly lower. So right here, I rode along the mandible, and then over here, I'm going to ride a little bit further. So I give her 2 points of tension. So good. She's getting really tight here. Can you explain your 4x4 rule again? Again, I custom to everyone. So I like the idea of starting with 4x4 because it's easy to remember. B, you want more points of tension. So if I'm going to only use 1 port here, I've got to make sure that depending on what the problem is, do I need to pick up the cheek? Do I need to pick up the nasolabial folds? 4 kind of, if you look at your fingers like this, it kind of gives you a little bit of pull, like how you would normally pull up your skin. Here, it gives you enough tension to really pull that skin. If you use 1 or 2, you're just not going to have a lot of longevity. Same on the jawline. You want to be able, I like at least 2 in each port because I usually do a surgeon's tie. I'm not going to do that today, but the other thing that you can do is you can twist them because the cogs will twist each other. And that'll act more like a fixing point, which is what you want because it's the fixing point that allows you to have a direction to the thread. Looking so good. And I'm always checking. I'm always having them sit up and see what everything looks like before I make the final decision to cut. Scar tissue, no. Again, it's type 1 collagen. Doing okay?
Yes.
So good.
Excellent.
So I'm going to have her sit up. You can just go ahead and sit up. I won't use that. So you can see she got a lot of nice pull. So someone asked questions about, chin down a little bit, asked the questions about what do you do? She doesn't have any puckering, thank goodness. But if she did have puckering, you would take your thumb and you would just unzip everything. And it's pretty easy to do. Just make sure that you don't cut, have them sit up and look at them and then decide, how you want to proceed from there. Okay, go ahead and lay back. We're going to start with the smooth threads. So I'm starting out with the 25 gauge 60 millimeters. These are the longer threads. These are my favorite. You want the length because if you want to do some weaving, especially if they have some submental fullness, you want to be able to weave in and out of that tissue because it'll act like a hammock. Lift up. You want to go parallel. So especially when you're trying to crisp up a jawline, you want to make sure that you're parallel. If you're trying to lift the tissues in the cheek, you want to make sure that you're perpendicular. Okay, so we'll go parallel. Now here I don't need to weave. She needs, when she sat up earlier, you could tell that she had a little bit of dragging skin, kind of that accordion. I'm going to use some screws in that area to volumize her a little bit because it's difficult to put filler in this area without making her look too chipmunky. But what the threads will do is contract her skin. It's almost like shrink wrap with the smooth threads. And I keep them in there. So again, you can use that rule. There's 10 in here. So you can use 5 here, and then 5 under that, directly under that submental. We'll change size when we come in here. That's just a functionality of space because you can't use, obviously, a long thread in that area. Doing so good. So I'm employing my left hand and I pull the skin onto the thread as opposed to pushing the needle in her skin. It's a lot more comfortable for them. So we've done 3 already. I used a little bit of epinephrine to help with the bruising, but not much. Some patients are really sensitive with epi, so I try not to use too much of it. Doing so good. So here I'm going to show you the weaving technique. Lift up all the way. So in this area where you have a little bit of more submental fullness, she doesn't have much. You want to do a little bit of weaving because what that'll do is act like a hammock. I don't know if you guys can see that. You see how I'm weaving in and out? So I want you guys to think of the barb threads as having a direction. Smooth threads don't have a direction and a vector, but they do tighten the skin inwardly. So you get that nice shrink wrap. That's going to be lovely. And just tell patients they might have a little bit of bruising, and that's okay. Do you like to do microneedling on some patients first to help them stimulate? Sure. Microneedling is great. I like to do that before. If you're going to do that after, wait at least 2 months. Especially with the smooth threads, because you don't want to disrupt. Some of the microneedlings go really deep, so you don't want to disrupt the smooth threads. What gauge PDO threads? I missed that one. Can we insert all 4 threads at the same port? Yes, you can. I just didn't, since I wasn't tying today, I didn't employ that method, but yes, you can. The max I would do is 4, though. I wouldn't do any more than 4 in one port. What gauge of PDO thread would you use for different areas? I would say, as much as possible, err on the larger gauge PDO threads gauge, because you want that lifting capacity. When you start using lower gauge barb threads, you just really start losing the effect quickly. It just doesn't last as long. Can you elaborate on different planes of putting? Yes, I can. So for her right now, I'm in the fat tissue because I want to cause some fat destruction. So the deeper you are in that the fat area, especially if they have a little bit of a larger fat pad area, you want to be in that fat pads so that you can really get some destruction. Like I said, it does. The smooth threads will do 3 things for you. It'll destruct some of the fat cells. It will cause a little bit of fibrosis, which will tighten the skin inwardly, and then it'll add blood flow to that skin. So that's why a lot of my patients that I'll just do smooth threads if they have melasma or rosacea, any skin irregularities, large pores, wrinkles. It's great for all of that. That's why at the 6-week mark, most of my patients say, oh, my skin looks just so beautiful. And that's because of the smooth threads. Why don't I use sterile gloves? It's a clean procedure. It's not a sterile procedure. That's why. Which would you recommend ordering? Barb and smooth? Both. You kind of can't do without both. Doing okay?
Yes.
Goody. Okay, we're almost done. Lift up all the way. Beautiful. Are you guys able to see this really well? Good. You see how I'm weaving? I really want to catch all aspects of that tissue so I can really pull the skin inward and make a really nice, crisp jawline and undercarriage. Really beautiful. Okay, so we're going to start with this. These are your 30 gauge. I think I have some twists in there too. Where would you want to use twists? I think that twists are really great for the, go ahead, put your chin down, for the lids, for saggy lids, because it'll act like a little bit of filler and prop that skin up really beautifully. I also like to use that in the submentum as well. So these are the shorter threads. So this is just a function of, because you can't fit longer threads when you get towards the middle, especially above the thyroid, which is usually where they have a whole bunch of wrinkling. So you want to use the shorter threads because it gives you a little bit more maneuvering. Lift up for me, honey. So here I go straight in. Here I'm a little more superficial because I want to build up the integrity and the quality of that skin. Because remember, when she sat up, she was a little bit loosey-goosey in here. So I want to make sure that she has enough collagen stimulation so that skin holds up really nicely. Can you show us how you know you're in the right plane in the sub-Q? Okay, that's a great question. It depends on if you're talking about barb or you're talking about the smooth thread. When you're talking about barb, you just want to be able to, again, employ that pinch technology or that pinch anatomy where you're pinching, not too hard, just sort of like a little forceps distance. I don't know if you guys can see that. But in this area, you just want to ride it along, sit up a little bit. You just want to put your bevel in there and glide in. You don't want to see the metal part or the silver part. So is this clear? If I pull up, can you see the depth? Can you guys see the depth there? A little bit? Good. That's the depth that you want to be in. If you were going deeper, which I'll show, if you're trying to get the fat pad, you would go a little bit deeper, right? Because the fat pad lays, so do you see how that's a little bit, the depth on that is, I can't pull as easily. Why did you add the bicarb to the lido with the epi and how much? I add the bicarb because lido stings. If you just put straight lido in, it just stings. I only really use the epi at the ports just so that when I start my port with the 18 gauge, it doesn't hurt, or it doesn't bleed rather. Can you show us the twist? Yes, I'll come and use the twist in a minute. Is there a reason you would use twists versus threads? If I want to volumize. So twists act as 0.05 of a filler. So if I want a little bit more volume, I will use the twists. Why do you use the twists like that? I think I said that. What level are you aiming to insert? I'm in the dermis with the smooth threads. What threads do you recommend for beginners? I think that the mint fine, I mean, definitely have more trainings, have somebody hands-on and show you how to do this and make sure that, because what I've found is every injector has a certain predisposition, whether it's they slant to the right, they slant to the left, they're a little bit too deep, they're a little bit too superficial. So you want someone to kind of stand over you and show you what kind of injector you are and what you lean towards. But definitely, I think that beginners can do barb and smooth threads. I love all the questions. They're great. Thank you. I'm not sure if you guys can see the depth that I'm in, but pretty superficial. Underneath the neck, it's really quite forgiving. It's when you get in this area. Just one of the things I caution you guys on is if you're doing smooth threads here, make sure you err a little bit more on the deeper side, because if you're too superficial, when they move their mouth, you'll see a little bit of puckering. Is there any risk to causing any damage to the mandibular nerve? Yes, if you're too deep. But again, I think if you use that pinch anatomy relatively, and remember that the mint fines are loaded on a cannula, so that's a bit safer. Are there different indications where smooth threads would be placed in the dermis versus sub-Q? You want to be in the dermis if you're trying to build the dermis. You're meaning that you want that crepey skin to get tighter. But if you really want to affect a fat pad, that's when you want to be a little bit deeper. By weaving, you mean between the dermis and the subdermis? Yes, that's exactly what I mean. Thank you for that question. Weaving technique for the smooth. Yes, you don't want to weave with the barb. So weaving just means angling up and down. Yes, that way you're catching both the fat and the dermis at the same time. Great questions. If you are in the subcutaneous tissue, how is she not feeling that? Oh, I've numbed her completely. She's very good. What else we got? We have to wrap up. No. We have to wrap up in 15 minutes, so let me finish her before she kills me. Thank you, everyone. I love all your questions. I hope everything was clear. You can DM me on my Instagram if you have more questions too, or talk to your rep as well. What gauge of smooth threads are you using? Today I used 25s and 29s. I used 30s. Oh, let's start with the twists. We'll use a little bit of that twist. So these are the twist threads. And again, twist threads act like 0.05 of a filler. So I don't know how clear you can see, but they're twisted around the thread. So any area where you want a little bit more volume, like in the brow area, especially for her, she's got a little accordion going on here. So you can use these straight up to give her a little bit of volume without making her volumized. So we'll go straight up. turn for me a little bit. And here I'm coming perpendicular because I want her to have a little scaffolding. So when she smiles, she has a little bit better skin quality in that area. And let me go ahead and cut for you guys so you guys can see how that's done before I finish all that. So we set her up. I liked how everything looked. Let me take these guys out of the way. I twist. Make sure you twist before you pull out, because sometimes these little guys come out when you don't want them to. So normally I would use a hemostat, but I don't have that today. So again, at the end, you can either use a surgeon's knot or you can twist. I'm just going to twist. And by twisting, that really anchors it into the tissue. And you want to make sure that you pull down. You want to make sure, do you see how I'm getting this puckering at the end? You want to make sure, because you want to redrape that skin over the ends of the threads. You want to make sure that no threads is sticking out. I like these curved scissors because you don't cut the skin. It's beautiful. And again, I'm going to twist. So as you're twisting, make sure you're pushing down, because you want to be able to embed the end of the thread into the skin. So you see how that puckering goes, and then just cut right up to the skin. And then you just repress the skin over on top, and then you just don't see anything. We have any last minute questions before I pull? Do you ever load the thread after placing the cannula? Yes, you can. There are companies. Nova Threads has that. They have infinity threads. What are the lengths of the different threads you are using? These are 30 and 60, I think. Can't find. Oh, I think we're good. Twisting and not at the end specific to mint threads. No, you can do that with any threads. Some have very thin skin. Yes, you don't want to do this on a patient with really thin skin. What is your deciding factor in choosing? Like I said, I really love the molded threads. I think that they're a lot stronger and they're going to last a lot longer. How long do you leave them in there? It just depends. I think there's a little bit of an acupuncture stimulation that goes on with the smooth threads. So I like to leave them in, and I'll do the other half, and then I pull at the very end. And so we'll pull. You doing okay? Mm-hmm. Such a good girl. You can see not a lot of trauma to the skin. When can they come back for more threads to the same area? Well, smooth threads you can throw in at any time. Usually you want to wait like 6 weeks. Barbed threads, you probably, unless you're trying to fix something, you generally would like it be good for you to wait at least 3 months before you start, unless you're doing a different area. Will you please, after you finish the procedure, will you tell us what antibiotics? I don't prescribe antibiotics unless it's necessary. I will put a little antibiotic ointment at the end where I opened. And I send them home with that. How do you determine the placement and the vector of smooth thread? So along the jawline, you want to make sure that you're parallel to the jawline if you're trying to make a sharp, crisp jawline. If you're trying to volumize, like I did with the twists, you want to make sure that they're perpendicular to where the wrinkling is happening, where the accordion is happening. I think we're good. So I'll have her sit up. So you can see that she got a lot of beautiful lift along that jawline. It's really lovely. And again, it'll continue. You'll notice when you bring them back for their 6-week follow-up, it'll get better and better over time. It'll be just beautiful. Her skin will start to glow. This skin will start to tighten up and it'll be just gorgeous. And then you can repeat. Not any tail threads. No need to cut them. I did cut them. I cut them at the end. We puckered and then we just cut them directly. Where do you use the 25 gauge and where do you use the 29? Again, you want to use the larger gauge a little bit deeper and the thinner gauge a little bit more superficial. How many threads can you insert in 1.4 if you're using barbed threads? I think I didn't see you pinching while inserting the barbs just because I do it so often, but if you're just beginning, it's a good idea to pinch. And we'll do cat eye next time, I promise. So good. You're doing okay?
Excellent.
Yay. So it's beautiful. Good job. Any other last minute questions? How come some practitioners pucker on purpose on the cheeks? When you mean pucker by pulling really tight, you can do that and then release it at the end. She just didn't need that. Do you use smooth or twisted in the cheeks? Both. It depends. Most of the time I'll use smooth. So I'll use smooth here if I want to tighten up. Remember, you're using your smooth to contract the tissue because you're going to have some inward contraction. So if you have a fat pocket, you're using it to reduce the fat in that area. If you're trying to tighten the skin, you'll be a little bit more superficial and then you'll tighten and retract up that skin. So you can use that on knees, you can use that on breasts, you can use that anywhere you have skin. Love your technique. Thank you for sharing. Thank you for watching. She is a beautiful model. She is. So gorgeous. Great job. Thank you. Thank you. Any other last minute questions? And we're good. They said I have to go. Love you all. Thank you. Mwah. Thank you. Yay.
That was good.
That 10-second delay threw me off.
I was getting